Talk about osteoarthritis,
Okay.
or OA for short.
Gotcha.
Osteoarthritis is incredibly common.
It is.
It's basically wear and tear on the cartilage in our joints,
Mm-hmm.
and it affects millions of people.
Millions.
The document defines it as a progressive deterioration of that cartilage.
Yeah.
And the stats are pretty eye-opening.
What are they?
Something like 10–12% of people experience it.
Wow.
And that number goes up as we get older.
It does.
Almost everyone over 65 shows some signs of osteoarthritis
Wow. Really?
on an X-ray.
Interesting.
So even if we don't feel it,
Yeah.
there might be some early signs happening in our joints.
Right.
What should we be looking out for?
Well, the most common symptom is joint pain.
Okay,
That gets worse with activity and eases with rest.
gotcha.
You might also experience stiffness in the morning,
Okay,
but it usually goes away within 30 minutes.
all right.
Sometimes there can be visible signs, too,
Oh, like what?
like a joint that looks a bit deformed or bony.
Okay.
Or maybe you hear a crackling sound when you move.
That crackling sound has a name, right?
It does.
That's the one.
And unfortunately, it's not just about pain.
Right.
Osteoarthritis can also limit your movement
Yeah.
and really impact your quality of life.
It can.
While there isn't a specific blood test for OA. Okay.
X-rays can show us what's happening in the joint.
Gotcha.
So those X-rays can reveal how much damage there is.
They can.
What exactly are they looking for?
They look for things like joint space narrowing,
Okay.
which means the cartilage is wearing down.
Hmm.
They also check for something called subchondral sclerosis, which is basically the bone underneath the cartilage getting thicker.
Gotcha.
And sometimes they see cysts, which are fluid-filled sacs, and those bony growths called osteophytes.
Okay, so those are all fancy medical terms.
Yeah.
But the changes that tell us how much wear and tear is happening in the joint.
Exactly.
So if we start noticing those symptoms, what can we do to manage osteoarthritis?
The goals are to manage the pain,
Okay,
keep you moving as well as possible, and try to prevent further damage.
gotcha.
It often starts with simple things you can do yourself.
Like what? Give us the lowdown.
Low-impact exercise is great
Okay.
because it strengthens the muscles around the joint without putting too much stress on it.
Right.
Think walking, swimming, or cycling. And if you need guidance, a physiotherapist or occupational therapist
Yeah.
can create a personalized exercise plan.
Awesome.
Losing weight if you need to
Okay.
can also make a big difference
Right.
because it takes pressure off your joints.
Makes sense.
And using assistive devices like a cane or braces can help support your joints
Yeah.
and make daily activities easier.
So those are all great ways to stay active and independent.
They are.
But what about medication?
Okay.
The document mentions quite a few options.
Yeah, that does.
For most people, simple painkillers like acetaminophen
Right.
are enough to manage the pain.
Mm-hmm.
But if that doesn't work,
Yeah.
we have other options that can target the inflammation in the joint.
We do. Like NSAIDs, we typically recommend those for short-term use.
Right.
In some cases, your doctor might suggest other medications
Okay.
like duloxetine or a combination of acetaminophen with codeine.
Gotcha.
And sometimes we use injections like steroids or hyaluronic acid
Okay.
to provide extra relief.
So it sounds like there's a whole toolbox of treatments to explore,
There is.
but the document also mentions surgery as a last resort.
You're right.
Surgery is only considered when other treatments haven't worked,
Correct.
and the pain and disability are really severe.
Yeah.
Even then, there are different types of procedures
Right.
depending on the joint and the extent of the damage.
Absolutely.
So it's really about finding the right combination of strategies
It is.
to manage the condition and maintain the best possible quality of life.
I agree.